Healthcare is above all else a human interaction between doctors and patients, nurses and loved ones, administrators and policymakers. The list just goes on. What kind of care do we all deserve? Those are the questions we must keep asking ourselves. Eventually, we will discover that there is a better way, and together we will create it.
10 years ago, we were founding the Helsinki Declaration on Patient Safety. And today, after 10 years, it's time to renew it.
10 years, it's too much for our patients. And now we together, patients and doctors, we can put the safety of the patient first.
Very often we all forget that we're all patients at some point, and that's the key to all of this, is what kind of care would you like to receive?
What happened to me happens also to other people who maybe not have the possibility to put it out in public.
Think that this is your mother, your daughter, or somebody who you love.
It's incredibly important for doctors and nurses to have a proper, meaningful relationship with the patient. That means that they think about what's sensible for the patient and what they need.
The question is, what kind of care do we want to receive? Do we want compassionate, empathetic care that sees us and sees our experiences, or do we want this disconnected relationship that seems to often happen, especially when things go wrong?
Sometimes things do go wrong, and it's the responsibility of everyone involved in the healthcare system, the industry, the hospitals, the users, to investigate and report these incidents so that we can follow up and improve our care in the interests of patients.
In order to push the patient safety at the top of the agenda. For that, you need good strategy behind, a good organization, and a lot of perseverance.
We urge the member states of the European Union to ensure quality standards for care in the perioperative period, facilitate data collection, measuring, monitoring, and improving patient safety, to promote excellence through education, research, and innovation.
Also very important that we work on communication, open disclosure.
It is an issue of culture, holding environment, and also the co-creation and collaboration of the various participants in health.
And the culture comes from the top.
Develop the culture of the patient safety in all professionals, stakeholders, and in the population.
Involve patients and families as true partners in care.
Trust is at the heart of all relationships, and when you're harmed in healthcare, what you want more than anything is to regain that trust. In the current system, it's difficult to do that, but coming here and seeing the people and seeing their passion, it really gives me hope and belief that we can get there.
The ESA and the other specialties and other stakeholders like pharmacists, hospitals, patients and all come together here trying to do something important for patient safety in Europe.
We need the decision makers to make a change.
It's time to reflect what we can improve.
It's an inspiration to everybody. It's fantastic.
The European Society of Anaesthesiology stands for patient safety because we are all